Thank you for tuning in to Iron and Pearls. I am back on here after a long absence. I have not been on here since December. I have been dealing with a pretty major health crisis, is what I thought. But it turns out that all of my tests are coming back normal, although I've had pain, abdominal distension, all kinds of weird sensations and feelings within my body. Just a lot of unexplainable things. Shortness of breath, nighttime hypoxia with my oxygen is dropping way low even though it's fine when they record it during the day. And the only thing that I can think at this point is that I was being put off track so that I wouldn't have the energy to get on here and speak to you. But no more. I'm been through tons and tons of doctors who have told me there's nothing wrong with me. They can't find anything wrong with me. I've been belittled by doctors. I've been discounted by doctors. I even had one doctor pretend to do an ultrasound, which I've had many in my life, and know that he did not even really attempt to do the ultrasound at one of the hospitals. And it has not been an easy road. I've dealt with abdominal distension that was so large it looked like I was carrying a 9-month baby. I have dealt with sponginess when I tried to take steps some days. I have dealt with headaches. I have dealt with nausea. I have dealt with, when this all came on back in January, out of the blue, I've never had problems with my blood pressure, but suddenly I have high blood pressure now, and they had to put me on blood pressure medication. They've looked at my heart and everything looks good. They've looked me over from head to toe. I've had CTs and MRIs. I've had blood work and x-rays. I've had ultrasounds. I've been told again and again and again that they can't find anything wrong with me. Even they've apologized to me for seeing me buckled over in severe above a 10 pain and just sent me home saying they couldn't find anything. You know, granted, they're not doing too many tests. They're doing like a blood test and a couple of imaging studies, and that's about as far as they'll go when you go to the ER. They tell you need to find a specialist, but that means you have to get a doctor, a general practitioner that's willing to listen to you to refer you to the right specialist. I even spent 2 nights in the hospital, and that's how they found out I was hypoxic at night. And for some reason, they put me on oxygen the whole time I was there, but they discharged me home after doing an endoscopy and everything else. They discharged me home with no oxygen, telling me I needed a sleep study. And 8 weeks later, I finally got a referral put in for a sleep study, which I actually have an appointment to go and speak to them about a possible sleep study in a couple weeks, but I don't know when I'll actually get that sleep study. Needless to say, I've been spending the last 3.5 months sleeping, sitting straight up. And I have in the past had spine surgery and cervical issues where they've done surgery. I actually have fused cervical vertebrae from C4 all the way down to C7 in my neck, and I also have fused areas in my lower spine from L5 to S1. So I've had a lot of things go on in my life that's caused my body a lot of trauma. I've had brain surgery in the past as well, and had post-surgical infection that almost took me. I've had the whole top of my skull removed because of that infection, and I've had it rebuilt with 3 ribs from my left side. I've had medical malpractice, and I've been discounted so many times in my life by doctors who, all I can understand is that, you know, for some maybe, you know, they genuinely are trying and they just don't know. For others, I really feel like they see me as, when I was a young woman and sick, they saw me as a young woman and naive, and they kind of treated me like, oh, and almost like they were patting me on the head and sending me on without really addressing my issues, which always turned out to be pretty major issues that required surgery in the end. And now that I'm past 50, it's the other way. I feel like that once you hit past 50, that now you're, somehow senile, and that it must all be hormones and, menopause, and, it's just so crazy how your symptoms get discounted because of their expectations when you hit a certain age. For the life of me, I cannot understand that. I've had a partial hysterectomy back when, so I still have ovaries. And I even had a general practitioner that was a female that I mentioned to her, to please, look for any causes, including the rarity of a possible abdominal pregnancy, which she argued me down and said that you don't have a uterus and that can't be possible. And I told her, well, they've checked me and I have not gone through menopause yet. And she said, what do you mean? And she started looking at all my records like real hurriedly and was like really freaked out kind of about the fact that I'm 54 and haven't gone through yet. But I have 2 functioning ovaries, and I don't understand why the United States is so backwards, because during all this time, the research I have done, I find that the government websites here for the United States, and I find websites for other countries like India and Germany, that they actually have a lot more knowledge when it comes to, what can happen with people, as they age, what's possible. So much so that in India, they've put out a statement that as long as a woman has not gone through menopause, and if she has even one ovary left and nothing else that's for reproductive ability, then she should be checked for a possible pregnancy, because it can still occur, and they haven't written how many times it has occurred in their countries. But in the United States, they will feed you the lie that there is no way, if you don't have your uterus, there is no way for you to become pregnant. What gets me is that our own research in this country shows that, though rarer, still it happens quite often that ectopic pregnancies that occur in the tubes occur when the ectopic pregnancies occur 90-something% of the time. But then there's those other few percent that occur beyond the tubes, whether it be in the cervix or vagina or just some other place. Whether you have a uterus or not, it can still occur. But they want to treat you like there's no possibility, it can't occur. Almost like my general practitioner looking at me in shock that when I told her that they discovered I haven't gone through menopause yet. Because if you don't have a uterus, then you don't have a cessation of your menses to give you the information you need to say, oh, I've gone through menopause, I'm in menopause. So you have to have it evaluated other ways. So I've been through the gambit. They have checked my heart. They have checked my lungs with an x-ray. I just had my final MRI. Finally, it took me forever. My general practitioner did not want to order an MRI. She beat around the bush for everything else except for an MRI. And in my life, I've been considered a 2%er by doctors, so that means I don't follow the same symptoms that 98% of the rest of the population do. So that being said, I have to really depend on more advanced tests for them to finally find out what's wrong with me, or until it gets so severe, sometimes I become hospitalized and then they find out what's wrong. But I usually have early warning signs that something's not quite right way before it gets that bad, before it starts affecting my organs and my other systems, and that's when you would like for the doctors to catch it. But that she didn't want to give me extra tests. I finally got a really young doctor who's like 30, a pain and spine specialist, and I went in and I told him, I said, I'm having shortness of breath. I had high blood pressure that came on out of the blue. I'm starting to have a distended abdomen that's more and more and more, and I can't lie down and sleep at night because I can't breathe. And even doing a little bits of exercise during the day, I start gasping for air, even though my oxygen shows that it's good. I said, I've had spinal surgery and cervical fusions. I believe, because there's been changes shown in C3 in my neck, and since C4 on down is fused, I believe that possibly my phrenic nerve has been damaged and that something is wrong with my diaphragm, and it's causing the rest of my abdomen muscles to try to pitch in to help me get greater airflow, which is causing me to have a distended belly. And after I told him this, I waited. I waited for him to tell me, oh no, I'm not going to do this. But that's not what happened. He actually looked at me and said, I think you're onto something. And he had my records in his hands. He had looked through my records. And he said, I think you're onto something. And finally, I had MRIs ordered. For good measure, he went ahead and ordered MRIs with contrast of my abdomen, my pelvis, and my chest. Well, my abdomen and my pelvis didn't show anything wrong, they said. And I had my chest one done after that, 2 days later, and I'm waiting for that result to come back. I have a sleep study later, that evaluation for a sleep study later this month, so hopefully I'll be able to get that done, so at least they can help me with my hypoxia at night. All of these issues, are things they look at you if you're over 50 and say, well, this is normal possibly for things to come up with your blood pressure and sleep problems at your age. But I've always been in really good health. I've always been extremely active. And I worked right up until about September, October last year, when I suddenly started getting tireder than usual. I guess that was the first symptoms, was nausea, tiredness, and some weakness in my hands. Well, they've tested the muscles of my hands and my arms and found that they're actually improving since the last time they were tested a couple of years ago. So I'm not sure what all that is about. I mean, I do live with an AVM because it bled back when I was 30 pretty massively, and that's what led to the post-surgical infections and brain surgeries that I've had. But it's in a place they couldn't remove the whole thing, and it's kind of grown back and got a little bit bigger again. But it's not ruptured, and they've checked it this year, and it looks pretty stable. And I've read where a lot of times when you get to be my age, and they come back, that sometimes they stay stable as long as you don't have too much stress and problems with your blood pressure, which is why I'm in a hard strait right now, because I suddenly have high blood pressure that sometimes the blood pressure medicine doesn't manage very well. And if you've got an AVM and you have high blood pressure as well, you're at risk for a bleed, you're at risk for a stroke. And that's not something I want. I've already dealt with that before. I've already been there. I lost all kinds of abilities and even ability to walk, and had to gain all of that back. And I really don't want to go down that road again. But it's just been really hard, and I'm sure many of you understand what that's like. Waiting for a diagnosis, waiting so long for a diagnosis, getting worse and worse and worse every day, which right now I'm talking to you, and I'm starting to feel myself get a little short of breath. But I felt it put on my heart that I wasn't going to leave this and not come back to this. I felt like God was putting in my heart to do this anyway, to trust Him anyway, and regardless of, He keeps sending me scriptures that regardless of what the doctors say, regardless of what other people think, trust in me, trust in me. So I'm going to trust in God with all of this. And yes, I'm doing my due diligence. I'm going to every doctor's appointment. I'm taking all the information that they're giving me, which isn't a lot. It seems like at my age, they really want it to be nothing but constipation issues and stomach problems or reflux. They really, if they don't see something immediately on your heart, they really don't want to look much further. I mean, they'll tell you, go ahead and get yourself, checked out for colorectal cancer, and which would be, nice. I'd like to do that appointment too, but all of our gastro people here are backed up on appointments, and they're booked more than a year out. So because this place has lost so many doctors, and has not gotten them back and has lost funding. So it's really hard to get appropriate care here, to look at all your issues, to try to nail it down to see what's really going on with you. At this point, I've been relying on myself to look at my symptoms, to do all of my homework, do all kinds of research. I feel like I'm back in college and trying to just diagnose myself, because I'm not being listened to. I'm being discounted in most of the ways. I'm being given a rather hard time as someone who was completely healthy one day, and then the next day woke up having to go to the ER extremely unhealthy feeling. I don't understand why they're not able to find what's wrong with me, other than maybe I'm just not presenting, the way 98% of other people do, and instead I'm presenting like a 2%er. So that's my story. That's my update. That's where I've been. I apologize for not being on here, continuing on, giving you the understandings of scriptures and reading them with you and helping you to seek God and get closer to Him and have a closer relationship. So on this note, I will go ahead and do a quick information lesson for you. We're going to go ahead and look, and I'm not going to look at a lot of verses. I'm just going to look at a few. We're going to look at James chapter 1, verse 2 through 4. Because of what I've been going through, the struggles I've been going through, the struggles of my faith, hanging on to my faith, because I have nothing else. I mean, except for the support. I am fortunate. So many people don't have this. I have the support of my husband. And I'll tell you about some of those blessings when I get done sharing these scriptures. But thank you. I'm so thankful for him. He stood by my side through all of this. So James chapter 1, 2 through 4 says, "My brethren, count it all joy when ye fall into diverse temptations, knowing this, that the trying of your faith worketh patience. But let patience have her perfect work, that ye may be perfect and entire, wanting nothing." And then the next chapter, and the last chapter I want to give you, is 1 Peter chapter 1. It says, "Blessed be the God and Father of our Lord Jesus Christ, which according to his abundant mercy hath begotten us again unto a lively hope by the resurrection of Jesus Christ from the dead, to an inheritance incorruptible and undefiled, and that fadeth not away, reserved in heaven for you, who are kept by the power of God through faith unto salvation, ready to be revealed in the last time, wherein ye greatly rejoice, though now for a season, if need be, ye are in heaviness through manifold temptations, that the trial of your faith, being much more precious than of gold that perisheth, though it be tried with fire, might be found unto praise and honor and glory at the appearing of Jesus Christ, whom having not seen, ye love, in whom, though now ye see him not, yet believing, ye rejoice with joy unspeakable and full of glory, receiving the end of your faith, even the salvation of your souls." And that's where I'm at right now. When I went into this, before I got sick, my husband sometimes, he was short of patience. And it wasn't really directed at me. But because I grew up in a home where there was lots of abuse, mental abuse, physical abuse, and dealt with people that were short on patience, as an adult, it's a trigger for me for past events. And so it would leave me crying sometimes. But through this, since I have become sick, you never know what to expect when you're with someone whose patience isn't that mature yet. But with this and through this, God has increasingly blessed us more and more. My husband has gained so much more patience and has been so gracious and loving and seeking God and encouraging me and wanting to read scriptures with me and not voicing his frustrations and his stress levels for me to hear them. So much so that now when my door opens in the afternoon, I'm excited that my husband is home. Now I smile every morning when I see him. No matter how I'm feeling, I try to get up to give him a kiss. If not, he comes to me and gives me a kiss. I have become more patient with him because of his patience, and I have appreciate him and respect him in a way that I never did before, because being unable to work, the burden of paying all of our bills and providing for all of our needs falls squarely on his shoulders alone now. And he has risen to that so greatly. I mean, I look at him and I see such a true man of God. And I feel so blessed that God brought him to me. He was the joy and the gift I was not looking for at this point in my life. I've gone through a divorce. I've gone through pain. I've gone through neglect. I've been cheated on. I've been thrown away and wasn't looking. And God brought me a godly man while I wasn't looking, to be here for me in these last parts of my life, to grow with, to be encouraged by, to be able to do my ministry and be supported as I've never been supported before. And I never would have expected such maturity out of a man that is more than 2 decades younger than me. And I was never looking for a younger man. And God did the impossible and brought me just that anyway. We have been together now for 4.5 years, married 1.5 years of that. And all I can say is, praise be to you, Lord. Only God can do something like that in someone's life. Because I chose before, and my choice, led me to maybe have a man that would provide for family and, for be a pretty decent father overall to my kids. But as far as a mate for me overall and looking for my good and being the head of the household and following Christ, I didn't really have that before. And that's my fault for not waiting on God to bring me the godly man that I should have waited for. And now, after having waited for that, knowing that I could possibly spend the rest of my life just me and God and being okay with that, I gave that all to him and I was okay with that. And yet he brought me someone unexpected, someone totally unexpected. Someone totally out of my purview, someone I would have never looked at in a million years. Because I've spent my life doing youth ministry, working with young people and helping guide them to Christ and sharing Christ's love with them. I would have never expected to choose a young person to spend my life with. It just was something totally outside of anything I would have ever thought of or considered. But God is wonderful, and he is the creator of all. He knows us. He knows our needs, and he provides for us continuously in ways that we can't even imagine. If we just put our faith and trust in him, if we just give all of our things over to him and say, God, put our heads down and say, God, and be honest with him. I can't do this. I can't make this on my own. I can't get through this. I don't know what's coming. I've always been a child of God that needed to know what to expect, and he's always prepared me for things. Well, he's growing me this time because I don't know what to expect when I got sick, and I don't know what's coming, and I'm not prepared for any of this, other than the preparation of knowing that I love God, and he has me, whether he leaves me here or whether he brings me home to himself. He has me, and he has my family here. And I trust that and believe in that wholeheartedly. And I pray that all of you that tune in, all of you that look at this video, all of you that listen and hear this, that you will be blessed and encouraged by this. and that you will check back in with me as I do my best to, through God, to make this channel more real, more lifelike, and share my life with you, share even my history of blessings and encouragements with you, and share with things going on, share about things in the world and what Scripture says about these things and what we should do about it. Right now is a really hard time. Our churches are falling apart. They have forgotten their first love. The pastors, we know about television pastors that have fallen away. Well, now we've got other pastors that authored books that are being used in our colleges, the religious studies, and in our churches, books that have as references to help us with Bible studies, that now those authors, they're falling. And it's a travesty because they're falling and they're not doing ministry anymore because they sinned. But as a Christian people, we all sin, and we should rally around those people and lift them up and encourage them and let them ask for forgiveness and pray for them and see if God would restore them to that position where that they can bring others and use their talents and gifts still. Because people say, pastors, well, once they've done this, they can't lead anymore. But they are people too, and we should lift them up. And there are a lot of abominations happening right now, a lot of things that God has specifically told us no to, and that people are taking His word about loving one another and not using it right, because loving one another is, as you love yourself, loving the other people is not the same as saying, oh, everything goes. Oh, be okay with everyone. Oh, let everything, be out there any way that anybody wants it to be. That's not what that means. When God says, love others as you love yourself, well, if you love yourself, you need to learn what that love is through Christ. What does that love look like? And I'm going to tell you, that love